Welcome. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I want to thank you for joining us for this week's cross-industry Boulder County Public Health Update. As a reminder, please put your questions in the Q&A. We save the chat for pushing information out to you. We have a lot of people on these calls, so we do not let you raise your hand and answer or talk live. So I will ask the questions on your behalf. Again, we'll start with Boulder County Public Health giving updates, and then we'll go right into questions. So we'll start with Jesse. Jesse, let's bring that volume up. Sometimes they can't hear you.
Yes, absolutely. Can you hear me now?
We can hear you.
Great. Good. So just want to start, apologize for not sharing my screen, my camera. My internet connection is bad today, so you don't get to see me. Okay, so jumping right in, we'll do the epidemiological update and our dial status, and then finish with public health order updates, and then go into questions. So I think the big message from the epidemiological update is we have seen a pretty significant decline in the number of cases that we're getting each day, which is great news, and it's a trend we want to see continue. We are, still seeing a high number of tests being done, and that's great because then that's really giving us a real picture of what's happening in the community. So that's good news. Just also wanted to show here that we're seeing that decrease across all age groups. There is some leveling off happening, but generally all the age groups that saw a spike back through November are now, the case numbers are on decline. So that's good news. Again, we are seeing continued disparities in the Hispanic and Latinx community. You can see here on the chart that unfortunately, while they make up about 14% of the community as a whole, they make up about 41% of our cases. So very disproportionate impact on our Hispanic and Latinx community. Just looking at city by city statistics, again, we're seeing a lot of those cases in Longmont. In the past 7 days, about 25% of our cases have been in the city of Boulder, and about 48% have been in Longmont. Another way of looking at the data, and just over since the beginning of November, just looking at age group, and again, this is something that we haven't talked a ton about, but we're still seeing our highest case numbers in that 18 to 22-year-old age group. While rates have been increasing for all of them, the pure number of cases in the 18 to 22-year-old age group is still higher than most. So just overall takeaways here, case numbers remain high. We are seeing that decline, but the numbers are still much higher than they were during the summer and in the early part of fall. Long-term care facility cases are rising. This is a concerning trend, especially before the vaccine is fully rolled out. Case rates are decreasing for all age groups. Again, good bit of news there, but unfortunately, we're seeing disparities in our Hispanic and Latinx community case counts, and that's disconcerting and really a thing that Boulder County Public Health is really trying to get at with communication with our communities. And then finally, hospitalizations have increased locally. We're seeing across the state a decline, and we're actually seeing in some metrics a decline there, but locally our numbers show a slight increase. So in terms of where we are on the dial, we are still in red. We are seeing good trends, however. Our current 2-week cumulative incidence rates per 100,000 is 522, which is way better than we were up at 800, above 800 at one point. So we are headed in the right direction. That's good news. We need to keep doing what we're doing and bring those case counts down, and then we can look at changes in the future. In terms of our 2-week testing positivity rate, also a really good sign here. We're headed in the right direction. At one point a couple weeks ago, we were at 8%. We're now at 5.9. That is great. And then our hospitalization status, again, another good week where our hospitalizations are at 11 days of decreasing or stable admission, which is really great. So the hospitalizations information, remember that there's sort of a difference between the number of beds occupied in our hospitals within the county and that hospitalization rate metric that the state looks at. The state is looking at the number of Boulder County residents that are hospitalized during that 2-week period. This number is looking at the number of beds occupied in our hospitals for COVID-19 over, on a rolling basis. And as you can see, there's that slight uptick at the very end there. And that's something that we're concerned about. As of Monday, 85 people were hospitalized in Boulder County hospitals for COVID-19, which is up by 11 from last Tuesday. So just changing there. Last thing here about our dial. We put this slide in the last couple times. I think it's important to note that level purple is really focused purely on hospital capacity. And right now our hospitals still have capacity. Our staffing is good, but as always, our medical professionals in our hospitals are working a lot of shifts and doing a lot of great work. And that is the one stress point we continue to see. So switching gears completely towards our public health orders, I just want to remind everyone, just a weekly reminder, you need to wear masks indoors. The state changed the public health order with respect to masks to specifically indicate that masks must be worn indoors. There was a time earlier in the year when the order stated that anyone in or moving through a building needed to wear a mask, and a lot of people pointed out that didn't specifically indicate that if you were seated in a building you needed to wear a mask, and the new order makes clear that if you are in a building, sitting, standing, moving, whatever, you need to be wearing a mask. So please continue to do that. Face shields are not adequate. They are not a replacement for facial coverings. And if there are questions about that, we can get into that. And remember that you as a business owner or manager have the right to bar entrance to anyone who will not or cannot comply with the masking order. In terms of general updates, I gave the masking order update already. The public health order has also been updated to give more guidance on temporary walls in terms of what is required for a temporary wall and who needs to approve that temporary wall. And so I encourage you, if you're still looking at temporary wall fixes, to look into that. I don't want to go into a ton of detail here. And then there's still some clarification working on this, but remember that while retail establishments are allowed to have 50% capacity, you as the retail establishment need to be aware of your capacity at all times. This is not just we think we're at 50%. You need to be aware of where you are in your capacity. So the big thing, FiveStar Certification program. We are still reviewing this program. It just came out. It's from the state. They have a bunch of requirements. We do not qualify at this time. And we expect to, if this happens, if it works, it's going to be a collaboration between a lot of people. Municipalities, chambers of commerce, individuals, companies, everyone's going to have to get together to make this work. It is a huge lift, and it's something that the whole community is going to have to come together for. We just don't have the resources to stand up a program this robust. And so we're going to need everyone to come together if this is the direction that the community wants to go. As I said, this just came out, so everyone is still learning what it means and what it requires. And so we are going to share more details as they become available, as we understand them, and as communities come together to figure out how to make this work. Lane or Corinne, do you want to add anything here?
No, I think that, again, that message of don't start sending applications in to public health or to chambers. I think if there's interest in forming something, which, hopefully municipalities, that have interest, there'll be a convening group, and then that word can get out of how do you join that group. But again, in the meantime, until something is formed, please respect that we are not actively reviewing or approving anything at this point. So I'm assuming there will be someone convening that, but it will not be public health. Again, we just don't have bandwidth to manage this program on top of vaccines and all the other activities we've been still doing, and then all the work we're still trying to do as normal public health.
I just want to add that, press releases did say to contact your local chamber. I just want to point out that the chambers are, and the economic development partnerships and the municipalities, we're all part of the discussion. But this program is a community-led program. It cannot be led by public health. If you read through it, it is going to take some time. It is a resource-heavy program, and one that we need to look at. But the key to the message that Jesse said is that Boulder County does not currently qualify. And so while we're working on this as a community, as the chambers, the municipalities, and the public health, to figure out how we could make this possible within Boulder County, we need to make sure that we continue to work to get our numbers down so that we can push us into orange, and so that this is the natural way to get us down on the dial as well. So just know that we're looking at it. We all got it last night. We all see the checklist. We all see what the certification program looks like, and it is a resource-heavy program that, again, as a chamber, we really want our businesses to be able to open at a higher capacity, but there are a lot of steps that have to be taken in order to be able to move forward with some sort of 5-star certification program in our community. So it's going to take some time. It's going to take some resources. It's going to take a lot of collaboration. So just know that that's where we are right now. And please, at this time, there's no application process. So there's no variance. We're not even currently able to qualify for it. So I already had some people try to submit an application to me this morning, and I know that public health has had similar things. We are not in orange. I know I have a question. I've already gotten some questions about that today as to whether or not we're in orange, and we're still in red at this point.
Thank you, Corinne. Thanks, Lane. I appreciate the expanding on that. It's really important that we understand where we all are as a community. I'm going to switch off that. Obviously, we can talk about it some more. We can talk about where we are on the dial and where and what it means to move on the dial when we get to questions. But I just wanted to do a couple more reminders about the, again, sick employees and outbreaks. If you have a sick employee, please, you don't need to shut down. It is important that you work with public health to make sure that you're following all the best practices, to ensure that there isn't an outbreak in your facility. But you do need to send home the sick employees. And this is something that I think has come up a lot. As business owners, it is your responsibility. You are required under the public health order to send employees who are symptomatic home. You are required. And if you don't make that choice, you endanger the rest of your team, and you could actually cause an outbreak, which would then require your facility to shut down for some period of time in order to try to reset your activities so we can ensure that your workers are safe. So another important part of this is, as you work with the sick employee and the rest of your staff, you need to be protecting the identity and the privacy of your employee, and at the same time identifying all those close contacts. So it's really important that you look at ways to understand the interactions of your staff on a daily basis. Using symptom checks is a great way to know who's where, when, and that helps you narrow down who could have had contact with a sick employee. And then just finally, sort of the biggest thing is if you're going to clean a sick employee's workspace or you know, the area they work in, you need to wait 24 hours. It's just a safety protocol. So a close contact, anyone within 6 feet for 15 minutes throughout the workday. So that's 15 minutes cumulative. And as I say every week, a contact of a contact is not a close contact. So if you know someone, if you have an employee whose spouse or child is sick or housemate is sick, they are a close contact, but none of the people that they are in contact with in your office are a close contact, unless that person then becomes positive for coronavirus. And then they would be, all employees who were close contacts would need to quarantine. Outbreaks. This is when you have 2 or more employees who test positive in a 2-week period, but that's not a guarantee that you have an outbreak. So contact us, close the business, contact us, and we will help you identify best practices as well as if it's an outbreak and what you need to do. So if everything goes according to plan, you may well be able to open the next day, and you know, we can work with you to protect your other employees. So the exposure notification system, gonna plug it again. I'm gonna do it every week, and I really encourage you to get in on this. The more people in it, the better it is at doing its job. Since you're here, you know about the Thursday 1 p.m. sessions, and those are going to continue. Our Friday 11 a.m. session this week is going to be about houses of worship. So please, if you're interested or if you are associated with a house of worship, please let them know that we're doing this. We're going to be talking about the new orders as well as best practices, as well as looking at just sort of reminding everyone of the importance of protecting your community, whatever that community may be. In this case, houses of worship, your faith community from the coronavirus, what the impact would be. Spanish language session in collaboration with the Latino Chamber. It gets recorded in advance and released on Thursdays, so please continue to check that out. Great resource for our whole community. And with that, happy to take questions.
Thank you. Can you explain how we get out of red?
Yes, I will run back to the dial just so, well, here, I'll put it on this. So the easy way to describe it is, so you've got these 3 metrics. You've got the 2-week cumulative incidence rate, the positivity rate, and the hospitalization status. If we can get all of those metrics into orange, then stay there for 2 weeks at that rate, then our whole county would move to orange. And we'd have to stay there for an extended period of time. And I think that's really the important thing. It's not just get there, it's stay there. And Lane, I saw you come off mute if you have anything to add.
Yeah, there's also a application step to the state to get their approval to move us to the better status. So that's the only other piece. And it's orange or better. So as you can see, our hospitalization status, our positivity has done fairly well throughout a lot of the big outbreaks. So that never moved to red. So again, it's orange or better, but in order to move to yellow, everything would have to get to yellow, and same with green and blue. So. And I saw a question about, would we be moving in like a week or something like that? So, you know, based on what Jesse just shared, we are still in red. You know, we haven't even made it to orange. We haven't stabilized there for at least 2 weeks and then haven't applied to the state. So it won't happen until hopefully early in 2021, but we have to get our numbers down and keep them down first.
The confusion lies in the fact that the dial order technically expires, but that is only because under the order, the dial order goes for 30 days, and then the governor will then extend the dial order. So that is the confusion that I'm hearing a lot of businesses had. So what it really means is, you know, the governor has this order, which is the order under which the dial operates. we're in red on the dial. That order will be most likely extended for another 30 days. He extends his orders on 30 days, and we are then going to continue to operate under red until we get our numbers down. I got some text messages about this morning because, you know, technically that particular order will need to be extended under the state. So we are in red until we get our numbers down. We maintain those numbers for at least 2 weeks, and then we apply to go to a lower level. You know, any order that comes out of the state, and that's the dial order, those are extended on 30-day increments. And the order that we're currently under is this order that we are operating under, a dial system. And for some reason, there's a rumor going around under businesses that that around this particular order, and I've tried to get rid of some of those rumors this morning via email and text.
Thanks for doing that. I guess I would just, to try to explain that a little bit, the way that public health orders are written and are allowed under state law, the governor has the right to put something in place for 30 days. So he has to every 30 days redo that approval, which is why the mask order is 30 days and why the dial order is 30 days.
So, and that's kind of what we've explained. So then the dial is the order that will be expended, and then we are under red right now.
Yep.
All right. So the question is, are we under a 14-day? There's a question if we're under a 14-day quarantine, and we're not technically under a quarantine right now, right?
No.
The county?
Nope.
Okay. Can you explain, you know, we heard that there's new quarantine guidance, though, that came out from the CDC. Can you explain how the state is dealing with that new quarantine guidance and how the county is dealing with that new quarantine guidance?
Yeah, so both CDPHE and the county are aware that there's new guidance from the CDC. And what we're seeing and what we're saying is that the 14-day quarantine period is still the preferred way to protect your staff and your community. So that is what we're holding everyone to. There are situations in which the alternative quarantine can work and maybe would be implemented, but we think the best way to control, and this is both the state and the county, we think the best way to control it is to continue with that 14 days. So that's what we're recommending.
And the public health order from the state has not changed away from the 14 days, and the state health department has not moved away from the 14 days, correct?
That is correct, yeah.
There's been a request to share any information on temporary walls, guidance on temporary walls. I did put in the guidance on outdoor dining structures. Are there any other guidances on temporary walls that are out there?
As we're talking here, I will grab that and share it. It's just going to take me a minute to dig that up.
Okay. Do we have any updates on the timeline for non-healthcare workers for vaccinations?
So the state website is your best bet for additional information on for your best bet for information on, you know, the schedule and the planning for that. We are following the state plan for administering the guidance, but I would say nothing has changed since last week and the week before. The general public is not going to be getting vaccines until likely late spring, early summer.
So right now we're in phase 1, which is, you know, the healthcare workers and, you know, we're in phase 1. The general public is in that phase 3. And a lot of those are on the state's vaccine website, which is what I send out via the emails. Okay. And there is a telephone number to the state if you have any specific questions on vaccine related questions. I did send that out in the latest email that I sent. It's a vaccine hotline. And then the frequently asked questions. There is a chart that kind of explains if we get the vaccine at the rate that they say we're going to, expected, what the expected timeline is on the frequently asked questions. I know that some people have been sending me emails asking to be put on the vaccine list. I have no control over that. So yeah, I just wanted to put that out there. I don't have any control over the vaccine. So just know
Just
that.
so, sort of going back to the temporary walls, I just posted a link to it. It is on the page under the work sites heading
Okay.
in the link that I sent. Happy to go over those things, but I think the biggest thing is any walls put in place temporarily need to be approved by the local building department, and they need to have no impact on the ventilation HVAC system. They can't ventilate one part of the room and leave the other part of the room unventilated through the installation of a temporary wall.
Okay. Thank you. We will send that out. We'll send that out today as well. So if someone is hearing about, I'm not going to put the particular restaurant in here, is hearing about a restaurant that is serving indoors. First off, you should not be serving food indoors or allowing seating for restaurants indoors currently under red. If they're hearing about a restaurant that is serving customers indoors, what should they do?
They should contact COVIDbiz at bouldercounty.org or our call center number, and we will investigate.
Okay.
They can also share that with the local municipality,
Right.
but we will also do that. So if they get a hold of COVIDbiz, we can let the municipalities know as well.
All right. Let's talk a little bit about retail. Is there any specificity on when you need to use gloves in retail? Glove usage in retail, when it's required, when it's recommended?
I would have to look directly at the orders, but as far as I know, there is no requirement for retail workers to be wearing gloves. But if you'll move on, I can quickly look that up.
Okay, and while they're doing that, Lane, you could probably answer this question. The outdoor dining, there are the rules, and I put this in there, the guidance for outdoor dining structures. And there are a lot of, there's a question about how is their enforcement being done on the outdoor dining structures so that there's level playing field, because not everybody, there's a perception that not everybody's following the rules the same on the outdoor dining structures. Yeah,
it's the same response as the question about if people are doing indoor dining. So to alert COVIDbiz. So, it is pretty strict on what would be considered outdoor versus still indoor. And it has to have two walls that are adjacent or opposite from each other that are removed to be considered outdoor. It can't be just windows open. It can't be two adjacent walls. So it's pretty strict on what would qualify as an outdoor. Certainly all four walls in a roof in a tent that's outside of a building is considered an indoor space for the COVID purposes. So, but that guidance kind of lays out what qualifies, and if people are not doing that, they either need to comply or, they are potentially subject to enforcement.
Okay. Can you explain if there was a Thanksgiving spike and why, and if there wasn't, how we were able to keep our numbers down?
So go ahead, Lane, sorry.
I didn't know if you were still looking for the other piece. But maybe if you put up that slide, that shows, that the decline in cases. So the answer is no, we did not see that, which has been fantastic, which means people really did follow through and limit their gatherings, make sure they were social distancing and wearing masks. And that's the exact same thing that we need through the rest of the holidays, through the end of the year, especially New Year's. We have looked at different counties across the state. It's not exactly the same across all counties. All the counties that went to red, I think, have seen that. The counties that didn't necessarily do that, that stayed in orange, even if maybe their metrics weren't supporting that. Some of those did not do as well. And then other states across the country have seen significant Thanksgiving spikes, and also did not necessarily have the same policies in place that Colorado did. So between the red status, which pretty much went in across the state, and I think people doing a good job of not hosting large gatherings, especially indoor gatherings, we really dodged that bullet, and we need to dodge it again through the end of the year.
Flip your slides, Jesse.
Oh, you're seeing my notes. Okay.
Yeah, we're seeing your notes. All right. So we did have a question as to, our cases are going down, but our hospitalizations are, slightly, and that's due to the delay. It takes a little while to end up in the hospital after cases. Boulder County seeing their numbers, but some of our surrounding counties are still seeing pretty high numbers, are some of our surrounding counties. So I think there is still some fear around Christmas. There's still some fear around New Year's.
Yeah.
So we have to make sure we keep diligent, especially around those two holidays that tend to be when you come together with other people.
Yeah. And Jesse's covered this a lot, and I know it's complicated. When you look at our infrastructure, all of our healthcare system, our hospitals that are located in Boulder County, they serve a wide variety of folks. So people that do not live in Boulder County. So the capacity of our hospitals is as important. We are concerned about our residents and their health, but the capacity of our hospitals is our capacity. So if people in Boulder County started to get sick, that is the closest and most available infrastructure. And if our capacity is diminished, now we have to try to look at other counties who are also likely going to be getting stressed. So the capacity of our hospitals is still a very important metric. And unfortunately, the state metric, the way that they need to do it is look at where residents live and where are the hospitalizations coming from. So it's sometimes a misnomer when you see it looks like everything's going great for Boulder County, but not necessarily for our hospitals. And that then influences any need for ICU beds. The capacity is limited. So not just for COVID, it's anything that people would need ICU for. That's again, our concern is, and it starts to influence what kind of procedures hospitals can even take on. So elective procedures then start to get canceled. And so it has lots of ripple effects beyond just COVID patients.
So we can push through these holidays, stay, don't gather, continue to maintain your distance, wear your mask. Let's stay diligent during this time. So Jesse, I know you posted the retail, but there's a specific, there's specifically in there, require the use of face coverings or masks and gloves, and create signage to require the use of face coverings or masks and gloves.
Right.
So I think there's just some confusion of what does and gloves mean and when does gloves need to be used.
So this falls back on the retailer, unfortunately. So that's guidance as opposed to the order itself. And so the guidance is that you should require gloves and a mask. I mean, a mask is required regardless, but the guidance is that gloves should be required. I would work with your professional association or association of retailers to see if there is any sort of national level guidance on when the best times to wear gloves are, because this is not outlined in the order itself.
And I posted just a very brief statement. The recommendation is, well, you need to have face coverings, but the mask and glove combo is really for those customer interactions. So thinking about your checkout counters or however you're servicing your customers, that is the point where the gloves, but masks are needed, really at all times.
Okay, so let's talk a little bit about employees, testing, things like that.
Mm-hmm.
So we have a company that had an employee who tested positive for COVID-19 and recovered. If that employee experiences symptoms again later, such as a cough or sore throat, and does not have a fever, do they still need to be excluded from work for 10 days even though they've already recovered from COVID-19?
It depends. So the current, and Lena, correct me if I'm wrong here, but my understanding is that the current CDC guidance is that you're protected for what they think is about 90 days. So during that period, they do not think you can get COVID-19 again. But if it's been more than 90 days, you could certainly get COVID-19 again. So it's probably best for that person to stay home. The other thing I would say is if it hasn't been 90 days, if it is okay and possible to have that person stay home, even if maybe not for the 10 days, remember that there is still the flu, there are still colds, there is still sickness in the community outside of COVID-19. And the more we get people to stay home, the less that happens, and the less we have people burdening our medical system.
So if you have symptoms, symptoms, stay home as long as you have symptoms,
Yep.
whether it's COVID-19 or not.
Yep.
Yeah, I think that's just the general guidance that hopefully businesses already have in place around illness and wellness policies. Is when you're sick, it's best not to come in and try and make the rest of the folks sick. But again, if they've already recovered from COVID, it would be unlikely that they have COVID again if it's with shorter time span.
Okay. All right. So question is, what's the best way to bring back a sick employee? Should we require a negative test? When does a sick employee come back?
So a sick employee can come back once they have completed their 10 days and no longer have a fever. They can continue to test positive based on the presence of dead virus in their system or inert virus in their system for quite some time. So a negative test is not a good measure. If they've made it through their 10 days of isolation, they no longer have a fever, then they can return.
Okay. So 10 days plus the plus
24 hours fever free, and it has to be not drug assisted.
Okay.
That's not the right term. I don't know. Lane, do you know what it is?
So they're not using any fever suppression medicines like ibuprofen.
Yeah, so you didn't use ibuprofen to get your fever down. Exactly. So, you've gone your 10 days. And let's say you didn't have any symptoms, you still have to wait the 10 days of isolation. Let's say you had symptoms, you go the 10 days and then you still have a fever, you have to wait till additional days, 24 hours past when that fever goes away. We've had the question of, well, I still have loss of taste, or smell. That's not one of the symptoms that you have to wait the 24 hours past, because some people go months where they still still have that loss of taste and smell.
Yeah, the fever is the specific symptom that needs to for sure be gone, because that is a sign that you still have an infection in your body.
Okay. So there is the number 1 in 42 Coloradans are infected or contagious with the virus statement. That seems to say that about 140,000 folks are currently infected, but currently that's not the number of total cases. Can you, and I sent you this via email, but it's also coming via, how is that calculated? If you're able to explain a little bit about how the state is kind of coming up with that number. And that is, in some cases, those are people that are carrying the virus but don't know they have the virus. Can you give a little bit of insight into maybe how that number is calculated and why that number is being publicized throughout the state?
Sure. Lane, do you want to take a crack at it, or I'm happy to if you want?
Yeah, I'll just give you rough. This is the area where Jesse and I get a lot of support from our epidemiologists, but these are the projections based on all the data that is being collected, looking at our kind of positivity percents, how much testing we have, how many positive cases have been identified. So these are giving those a little bit more of a rough estimate of how bad it is in Colorado. So that's a big difference than where we were over the summer. So it's a dramatic increase. There's a lot more disease in the community now than there was. But yeah, it's not an exact measured number. That is an estimated number.
Yeah, yeah, exactly as Lane said. It's sort of, you take the number of people who test in, over a period of time, you take the number of people who were positive but had no symptoms, and then you sort of extrapolate that to the entire community, because we know that there are people who have the virus who are not getting tested, and we know that there are people with symptoms that are not getting tested, and we also know that there are a lot of people without symptoms that are not getting tested. So we have to somehow capture those, and so they use a model to do that, and that's where they come up with this number.
And this isn't different for COVID than it is for pretty much every type of disease and issue we deal with in public health. Is you never identify all of the people who have the disease of concern, partially because people, like Jesse said, won't get tested even when they're sick. Then we have the people who are sick and don't know it, so they're obviously unaware, so they're not likely to get tested or identified. So there's just a whole host of reasons why we never are able to account for the exact number of illnesses, and there's often projections done.
So it's modeling done by, the public health epidemiologists, based on those, and based on that modeling, that's the number that the state has been using, but it's not the exact number that have tested positive,
Right.
necessarily.
Right.
Okay. It's been used to kind of give people an idea, like when you go to a gathering, if it's 1 in 41, it's to give you that idea that there's a good number of people that may be asymptomatic that could be in that room that could be carrying the virus, and to give people a kind of a number to think in their head, how many people here could be positive that you don't even know.
Right.
Yeah, it's just another way to present information that hopefully is maybe more digestible. Some of the other metrics that are being used when you're looking at case counts per 100,000, that, just hopefully one of the metrics is more resonating with folks, but they're all, again, painting, hopefully the same picture of what are we seeing and what's happening. Are things getting better? Are they getting worse? And that's our goal, is for people to understand kind of where we're at. The slide that's still been on the screen hopefully speaks volumes. You can just see the difference of where we've been throughout the year, and then what happened, at least locally, with the CU outbreak, and then what happened with, our countywide and statewide outbreak. It's just a radical difference there in what's been happening than what we had really been dealing with.
So have we seen flu hit yet? And is it presenting yet in our emergency rooms? What's the deal with flu? Is this quite the peak of flu season?
I don't think this is the peak, and I don't have any of the data on.
Yeah, neither do I.
So I know the state typically does track that, as does the CDC, but I don't have any of those stats available. Typically, though, that we wouldn't see the peak this early. This is more the beginning of flu season. Typically is around October, November, and then it varies. You never know when the peak is until it's already happened. So we often aren't able to tell you when the peak was until it's already come and gone. And then again, there's different models and predictions for that. It's always dependent on the amount of people that get vaccinated.
Okay. And we got this question before, and I think there's confusion. The PCR test for COVID-19 does not test for flu. It's not going to pick up flu. It's a PCR test for COVID-19, correct?
Yeah.
Okay.
Now, depending on where you're going and what they're doing, they may test you for multiple things, but it would be a different test to test for flu.
All right. What steps should you take if there's a close contact identified by an employee who tested negative but is still feeling symptoms and waiting to get retested?
So if they should be home as long as they feel symptoms. They should not be coming into work. The negative test does not clear them.
Yeah, if somebody is deemed a close contact of a known case, they have to quarantine. So again, there's only a few mitigating circumstances where the new CDC guidance would be implemented, but you need to quarantine for 14 days. If
So
you
very-
were if you were a close contact of somebody who was ill and they test and they don't have COVID, they still could, I guess, get COVID, but that was not why they were ill. So then you're not considered a COVID close contact. You do not need to quarantine.
So that's the
again the
differentiation.
reason- yeah, that's the reason we really do want people to test when they're ill, is to find out, is it COVID or is it something else? If it's not COVID, we don't need all those other people to now quarantine. So that has a huge impact on all the other people who would potentially need to quarantine, and then do not because the person tested negative.
So 2 more vaccine questions. One is, apparently there's some other states that have approved that places like restaurant employees, and some others in close contact are in more of that level 2 tier, that, with the essential workers, like grocery workers. Is that something that Colorado's looking at doing?
Again, I can't speak to where the final pieces will end up because there has been some changes in what the governor has put out. But I know that there's, I think every category of worker and entity wants to be as high on the list, which to me is encouraging that people are excited and want that vaccine. But I do not know where the final groupings will be. Our hope is that as we start to move into those phases, the vaccine availability is going to just continue to increase as it already has been, so that there won't be significant delays in the phases, that things will just keep rolling out very quickly. That's kind of what it appears. We've already seen vaccines rolling into the state. We've already had them administered. And again, it continues on that trend. So we're hopeful that even if you're designated in one versus another, there won't be a significant difference in how much time that is. It's really a matter of, for the earlier ones, it's the logistics of trying to get it and figure out how to administer it. Once we have widespread, you'll be able to go, or wide availability, you'll be able to go to, almost any of your normal providers for vaccines to get it. So it will be widely available.
Yeah. Right now it's pretty novel, and we're hearing about when the first 6 cases in Boulder County got it, because it's very limited numbers right now, but they're working on a distribution plan as more numbers and more vaccines are coming into the state. So
and just to let you know, it's much higher than that in Boulder County already. All of our hospitals have gotten shipments of hundreds of vaccines, and we're starting to get some for other, of those other critical responders. So yeah, we're already seeing hundreds and hundreds, if not thousands of vaccines just for Boulder County.
So once, so will orthodontists and dentists and some of those doctors' offices be contacted by the public health department once it's kind of their turn to receive the vaccine? That's another question. So
yeah, again, so we have a whole different branch that's coordinating the vaccination efforts, and I'm not sure what their plan is for contacting folks and how that will get rolled out, but yes, that I think that is their intent, but I can't speak to all of those details.
all right. So what is the current consensus for the average number of days a COVID carrier will be infectious or dangerous to others?
Well, again, they need to isolate for 10 days. So that's the number that they need to be focused on.
So the question is, somebody ends up in the hospital though, and on a ventilator, they're probably not contagious that whole time on the ventilator.
Yeah, I don't know. If they haven't recovered fully. So again, that's someone who's now in the hospital. So that means the virus is affecting them much differently than it's affecting others. So I can't say that when their infectious period stops, other than, so I don't know the answer to that.
They may still have a fever, and they may still, because right now it's isolation for 10 days plus, past when you have a fever. So who knows? We're not doctors on this call.
They may not be. I would assume that any patient that's being treated for COVID that's hospitalized and on a ventilator, they're still taking all of those universal precautions, and all of the staff are kind of it's in a high risk, unit of the hospital.
Okay, so Jesse, there's a last question in Q&A. So there were two questions that I did move out. One of them was very specific to gymnastics facilities. I did get your name and we'll follow up in a separate email. Another one was in response to another restaurant and specifically what happened at that restaurant. If you could send me your name and your email in a separate email so we can follow up separately, that'd be wonderful. It did come in as anonymous, so I was not able to capture your information. So send me an email at corinne.waldow@boulderchamber.com so we can follow up. But this last email is about 501c3 organizations who host, manage committee meetings or workshops inside private homes of a member. What guidance would that fall under?
So yeah, I without knowing specific details, it's hard for me to say. And the reason I say that is there are certain types of organizations that provide certain types of services that are considered essential. And so they have different regulations than others. But generally, if I were to just say an organization wants to gather at someone's private home, I would say that's a group gathering and that is not permitted. So
and if they
gathering
want
at
to
someone's
gather at
private
a
home is
venue
bad
that might fall under event, which is not allowed at this
also
time.
not allowed, right? Indoor events are not allowed. Just if you're meeting, it is better to do it online, I guess is the way I would.
If it's an AA meeting or an Alcoholics Anonymous or one of those, that's what you're trying to say,
Yes,
is that if it's
exactly.
something like that, that's a different type of meeting, and that might fall under a different type of the order. So you're not
Right.
able to just give
Blanket.
a general statement right here. You might need more specifics, and we might have to get this via email.
Exactly. And yeah, I would say that Alcoholics Anonymous is a perfect example of something where we're still recommending that they try to do virtual meetings, but we understand that there are certain types of group counseling that have a very good beneficial impact for the community that we want to continue and just haven't been as effective online or for whatever reason that may need to occur. There are still precautions those groups need to take. But generally, if you're having a board meeting for any kind of organization, having it in a private home is not permitted, and even having it in an office where you could figure out a way to have it in a big enough space where it wouldn't be, you'd have to have a gigantic room basically so that you could have 10% capacity, and even then it would be much better to do it virtually.
And then there's a question is there a way to anonymously submit feedback about facilities in town? So
through our website or the call center, you can be anonymous. A lot of people submit things as anonymous. I will say that it is, if for whatever reason the complaint goes to court, an anonymous complaint is much harder to prove, basically, than one that we can actually contact a person. But any contact with us is discoverable by the party that is complained against. So if you need to protect your identity, submit as anonymous. We'll work with that business. I want to make clear that generally our practice for all businesses is education first. We are trying to help them comply, not accusing people of purposeful non-compliance.
And I put the link to the Boulder County Public Health Forum, the Wufoo Forum, in the chat.
Thanks.
That people can use as well, so it's not the email or so that people don't have to call. So I did put the link to the form in there, and that was the last question because it did come in as anonymous, and I reread it and realized you're not going to want to send me an email either with your name in email. So there's a form there. I'm going to do last call for questions. Again, more details on all of the latest news, but key there is we're still in red. We still need to work through the holiday season to get our numbers down, and hopefully as a community we go into orange or yellow. Hopefully we can get our numbers way down so we can go down to yellow or even higher. Last call for questions. And just to let you know, next week this call falls on the 24th, Christmas Eve, and we're not going to do it on Christmas Eve. We will still do it on the 31st, but we are not going to do it on Christmas Eve. We hope everybody has a wonderful holiday. And at this time,
I can answer that. It's 350 or fewer cases.
to drop down to orange, we have to be at 350 or fewer cases.
Yep, 350 per 100,000. So
or 100,000 to drop down to orange. And right now we're in the 500s. But when we went up to red, when we were at red, we were in the 800s. So.
Yep.
And we need to sustain that number 350 or lower for at least 2 weeks.
2 weeks. So, all right. Well, I hope everybody has a wonderful holiday season. We will see you on the 31st again. In the meantime, please know you can email. We did in the comment form, the email addresses. You have my email, you have the email address for Boulder County Public Health. There you go, covidbiz@bouldercounty.org. The guidances are on the website, and you'll get information if anything changes from myself or others. So, thank you and have a wonderful day.
thanks everybody. Thanks Corinne. Thank you, Lane.
Thank you.